Menstrual health and hygiene is a critical yet often overlooked aspect of public health and education. And maintaining good menstrual hygiene can dramatically improve a woman's quality of life. The consequences of not doing so, however, can prove to be detrimental. But in spite of that, the fact remains that most conversations around menstruation are unfortunately often associated with shame, stigma, and deep-rooted societal taboo. So on the occasion of Menstrual Hygiene Day, celebrated annually on May 28th, we thought we'd take the opportunity to debunk some of the most common myths and misconceptions surrounding menstrual health. And to shed more light on this subject, I'm joined by a highly distinguished panel of domain experts. With that, I welcome you to our special feature, For Her, With Her. An initiative by Alembic CSR presents Prioritizing Menstrual Health and Hygiene in association with the Federation of Obstetric and Gynecological Societies of India. Please allow me to introduce our guests. We have with us Joint Treasurer of FOGSI, Dr. Niranjan Chavan. Dr. Chavan, so speaking of interventions, under what sort of scenario might a young girl consider delaying her monthly menstrual cycle, and what are the typical consequences of those interventions, of that decision to do so?
A very important question. It's not only young girls, but women in reproductive age, right, women who are just perimenopausal, just pop in the pills, to delay.
Right.
Now the delay, because there are exams, some of them want to go for a religious tour.
An athletic competition?
Yes. And we need to give them certain prescriptions, but do not do self, right, go on taking on your own. Your gynecologist is a friend. You can just call, you can just talk to them, and then they will advise you properly.
Right.
You have to understand the risk and the benefit, and taking prolonged estrogen over a period of time and trying to delay the periods is going to really affect your whole milieu of hormones. Right. It is going to cause excess of estrogen in the body, and over a period of time you might land up with irregular menses, infertility, or you might have something like hyperestrogenic state of a kind. So all these things you have to weigh. Just don't pop in pills which are just to be required if necessary. Right. And do not take on your own. Yeah. Because the measurement of the drug, the dosage is different for each and every condition, and also you might be having some other issues. And you just need to call us. We are always there to help you. We are always there to guide you.
Seek the guidance of a medical professional.
Yes.
All right. You, Dr. Chavan, women that are suffering from disabilities.
Disabilities, that is the worst scenario parents go through when they have a child with Down's syndrome. And I've seen that in educated women and parents, and they are really struggling to go through the whole process, and it can be a really complicated thing. Sure. You might be having a patient with physical disability, say polio, or you might be having a road traffic accident.
Right.
And suddenly you're bedridden.
Right.
And then you have to go through the whole process.
Right.
Menstruation is not going to stop.
Right.
It is going to be a part of the body, and that needs to be attended very sensitively, the respect of the patient, understanding their needs. And I have seen patients who have come for hysterectomies.
Right.
That decision has to be taken because it's going to be there for a long time.
Sure.
Maybe after the parents are becoming older, the other family members are going to take over, and it's really a very struggling issue which we need to understand. And there, the changing of pads, the proper disposal of the pads, technique to be put in, there needs to be an attendant, and all these things have to be taken care of.
Sharing such a rich range of insights from your personal journeys and your professional journeys. Thank you so much. With that, our special feature, For Her, With Her, an initiative by Alembic CSR, presents Prioritizing Menstrual Health and Hygiene in association with the Federation of Obstetric and Gynecological Societies of India, comes to a close. Thank you for tuning in.